Tips with Tony. Tips with Tony. All about nutrition from your favorite dietitian. Everything you need to digest in your mind. Tips with Tony. Tips with Tony. Making you healthier one bite at a time. With Tony. Woo.
Hello, and welcome to the Tips with Tony podcast. I'm Tony Marinucci, your registered dietitian, helping you get healthy one bite at a time. April is IBS Awareness Month, so I thought I'd dedicate an entire episode all about IBS. If you don't know, IBS stands for Irritable Bowel Syndrome. Irritable Bowel Syndrome is a disorder in which abdominal pain is associated with a range of symptoms. They typically include intermittent abdominal pain, accompanied by diarrhea or constipation, or sometimes the alternations of both. Other symptoms might be present, like bloating. If you have chronic or recurrent abdominal pain and bowel problems, if your daily schedule, like your bowel movements, is often ruled by intestinal discomfort, please get help. Talk to your doctor. A gastroenterologist is probably the best one to help diagnose you. And although there's currently no cure for IBS, there are ways to improve your symptoms and feel better. And I just want you to know that if you're experiencing these symptoms, you're not alone. IBS is common with an estimated 10 to 15% of people in the United States have it. And yet many people remain undiagnosed or unaware that their symptoms indicate a medical recognized disorder. So during this time in April, we try to make registered dietitians, nutrition professionals, medical professionals, we work to focus your attention on important health messages about IBS, diagnosis, treatment, and quality of life issues. I'm going to read you guys a lot of helpful tips that I got off directly from www.ibs.org. It is a wonderful website to learn all that you can do to help manage your IBS. Today, I'm going to share with you 21 ways that you can manage your IBS. So the first tip is to communicate with your family and friends. Don't let IBS overwhelm your personal relationships. What I mean by that is it can be a little bit, embarrassing maybe if you're always in the toilet, or you're feeling really uncomfortable and you don't want to maybe go out to this restaurant because maybe they have foods there that you know are going to cause more bloating. It can be just embarrassing to even your dating life to be able to say, like, I can't go out because I'm stuck on the toilet or in the middle of a date and just running to the bathroom. So communicate with people, kind of let them know that you're experiencing this, and recognize that your relationship with this person can actually strengthen through communication. Step number 2 is find relief. Many individuals with IBS find symptom relief and an improved sense of well-being when they incorporate relaxation techniques into their daily lives. So even just some deep breathing or letting yourself kind of rest is going to be really, really helpful because stress can cause more tension on the stomach and making those symptoms worse. So make sure that you find those times to relax, maybe meditation as an example. Number 3, the better you sleep, the less pain you're going to have. So your abdominal pain might be affecting your sleep. So you might want to improve your sleep hygiene, which I actually have a previous podcast episode 98, all about that. Some basic things to recap off of that is basically putting in some sort of bedtime routine, trying to keep your wake up time and your time that you go to bed consistent. Avoid caffeine at least 4 hours before going to bed, and avoid alcohol as well before bedtime. Tip number 4, breakfast is very important, especially with people with IBS, because it will help regulate your bowel movement. So if you suffer specifically from constipation, make sure you have breakfast. That meal will stimulate the colon and hopefully produce a bowel movement. Water will help with that too. So bonus tip there. Tip number 5 is actually help for children. So a lot of children with IBS will need reassurance to know that bowel problems happen to virtually everyone now and then. So help them make healthy choices, talk to them about their bowel habits, and recognize the developmental stages of your child. If necessary, be sure to work with your child's physician to plan a treatment that takes into account the child's point of view. But a lot of the stuff we're going to talk about today, you can also apply to children, except for when I discuss some supplements and stuff like that. That's when you might want to talk with your physician before, and that would be for yourself as well. So just be mindful of that. But I think the biggest takeaway with that is communicating with them, letting them know that it's normal, but having them be open and honest with you and not embarrassed if they do have diarrhea or if they're, having a stomach ache and they're feeling really bloated and, they've been in the bathroom for a while. Those are some clear signs that they're having issues. I did also do another podcast episode, and I can't remember the number of it, but a really great way to know is like if you're having issues with going to the bathroom, it's the 3x3x3 rule. So this is outside of kind of the tips, but it's helpful to know that basically if you're not going to the bathroom every 3 days, that's not great, right? So that's more on the constipation end. So daily, every other day. Every 3 days is a little bit pushing it, but it can be safe. But 3 days, more than that, there's probably some constipation there. At the same time, we shouldn't go more than 3 times in one day. So if you're going to the bathroom 3 or more times in a day, that could be a little bit too much. So you're probably experiencing irritable bowel syndrome. So those are some quick things. And then also, it should really take less than 3 minutes. It's like 3x3x3x3 rule or something. It should take less than 3 minutes for you to go be in and out of the bathroom. So if you're in there for longer than 3 minutes, there's an issue. And you also shouldn't have to wipe more than 3 times. Okay, so those are some helpful tips. Tip number 6 is all about probiotics. So probiotics may be helpful to some who suffer with IBS. Probiotics work with adding helpful bacteria back in the gut in an attempt to replace harmful gut bacteria. Studies have shown, particularly the strand Bifidobacterium infitis, which I am so bad at pronouncing all the times, might be superior to the placebo in relieving main symptoms of IBS. At the end, I'm going to tell you guys about a bonus tip, a little bit more about probiotics, but more so about prebiotics, which I don't know if you've heard of before. So we're going to talk about that kind of at the end when we kind of wrap through all these other options. So number 7 is medications that might worsen pain. Believe it or not, opioid-based pain medications such as morphine or oxycodone are prescribed to relieve pain. However, they should not be used for pain in IBS and other functional GI disorders. Under some circumstances and with some individuals, the use of narcotics can actually cause pain. If you use one of these drugs for IBS pain, and your pain seems to be getting worse, definitely talk to your doctor about switching to a non-narcotic substitute. All right, tip number 8. Keep moving, and that's in regular exercise. Regular exercise will improve bowel function, including the most common IBS symptom of bloating. So daily movement is super important to keep that bloating from worsening. Even just standing up at your desk, taking some stretch, moving your legs and your abdominal pain, maybe going around in a circle, stretching up, stretching down, touching your toes, getting that can be really helpful. And then going for a walk. So it doesn't always have to be like this crazy intense workout, but just walking more can be really helpful with that. Tip number 9 is for those who are pregnant. So when you're pregnant, chances are that it happens. Changes in bowel function are pretty common. So if you're experiencing excessive abdominal discomfort during your pregnancy, in that situation, if you're kind of going more towards the constipation, which is common in pregnancy and IBS, is try to, believe it or not, reduce gas-forming foods such as beans, cabbage, legumes, cauliflower, broccoli, lentils, and Brussels sprouts. So I think that's pretty much across the board. Anybody with IBS, whether it's especially if you're having diarrhea, because those foods also have a lot of fiber, they'll probably make the symptoms worse. So now, I guess that actually kind of leads to tip number 10, is all about fiber. So dietary fiber can affect symptoms in IBS to make them better or worse. For some, it may help to add fiber, and for others, it might be beneficial to reduce fiber. So it's likely that many people with IBS will benefit from adjustment in their fiber intake. So regardless, some of you, especially like I was saying, if you're more constipated, you might need a little bit more, but as you start to increase your fiber, also increase your water. And then if you're more on the diarrhea end, you're going to want to keep your diet pretty bland, pretty boring, and eventually maybe adding some fiber actually might help, like soluble fiber, which takes in the excess water. But in general, it's really difficult to tell. So you're going to have to play around with your diet, which we'll talk about in a little bit. Tip number 11 is, believe it or not, there are some other strategies that are not completely like the conventional medications. If they're not really if they're not completely controlling your symptoms, then there's actually some people that have mentioned that they've improved with things like cognitive therapy and hypnosis. So, I mean, listen, if you've been suffering for years and you've tried all the things, that might not be, what's worst case scenario if it doesn't work. If it seems like nothing's working right now, that might be something to consider. Hello, I'm interrupting this podcast episode for a brief announcement and special offer just for you. Did you know that April is IBS Awareness Month? Well, if you're someone who struggles with IBS, then listen up because I have a special offer just for you. Holy Ghost IBS Restore has been clinically proven to help nutritionally manage the symptoms of all types of irritable bowel syndrome, including constipation, diarrhea, and a mixture of both. Many who use this medical food have experienced relief in symptoms such as less bloating, less diarrhea, less constipation, and more normal bowel movements. 48% of users reported an improved overall quality of life, including an increase in energy, decrease in irritability, and just an overall better mood. It comes in a powdered form, so you can put it in your water, in your smoothie in the morning, or even your hot or cold cereal. It doesn't have any flavor or coloring. So you won't even notice that it's there, other than beginning to feel symptom relief after adding it to your daily routine for a certain period of time. It doesn't contain gluten, preservatives, GMOs, or soy, and it's free from artificial flavorings, sweeteners, and colorings. This is not like your typical probiotic. Holy Ghost IBS Restore actually contains unique microbiome nutrients called HMOs that fuel the good bacteria that are already in your gut rather than bringing in some sort of good bacteria that hasn't been there before. So unlike probiotics, which add foreign bacteria to your body, IBS Restore works with your body's own good bacteria. Simply put, it works by selectively nourishing and stimulating the growth of your own good bacteria, activating them to thrive and outperform the bad bacteria. So if you want to give Holy Ghost IBS Restore a try, go to holios.com or the link in the show notes. And don't forget to use discount code TIPS30 at checkout to get 30% off your order. So tip number 12 is the 4 to 12 week elimination diet to help identify your problems. And so this you hear very common, and I strongly encourage it, but I encourage it mostly when you're working with a nutrition professional, because otherwise it can be really restrictive and kind of play into that diet culture and realizing that this is really more to heal. This isn't because you're being on a restrictive diet because you need to lose weight, which can be sometimes confusing, but this is more so for each person. You're going to respond differently to different foods, and something that causes symptoms in you might not for somebody else. So trying like a 4 to 12 week elimination diet to identify which foods may intensify your symptoms can be really helpful. So that's a little bit more of, I would say, more advanced strategy, and that's why I would say work with a nutrition professional, because if you just, you eliminate all dairy, all wheat and gluten, all carbohydrates, or however you do it, it can feel really restrictive, and you don't always know the alternative. So it's helpful to have someone do that. And don't forget to add those foods back. I think that's the biggest thing that happens with the elimination diet is we fear adding foods back in. Definitely keeping a food diary I think that, to be honest, is something I implement in all of my clients, regardless if you have IBS or not, because just being aware, we don't all digest the same foods the same. And so keeping a food diary for 1 or 2 weeks can help you identify the factors that bring on the symptoms or make your conditions worse. So the difference between, someone who's keeping a food diary for weight loss versus someone who's keeping a food diary for IBS is the person for weight loss they might indicate their bowel movements. I do encourage it, but you definitely want to indicate your bowel movements when you keep a food diary. So mention did I have a bowel movement today? Was it easy to go? Was it difficult to go? All of those things. So tip number 14 is for women. So women with IBS more frequently report painful menstruation and PMS compared to those with IBS. So that's really interesting because I think that's something to pay attention to, is that during your PMS is not supposed to be, your menstruation is not supposed to be painful. And if you're having really bad PMS, it could be related to the IBS. So it's important to definitely talk to your gynecologist and your gastroenterologist, and definitely speak up to them about those, see if they can help you with that. Tip number 15 is actually all about those who have IBS is affecting your sex life, because sexual difficulty is reported by a disproportionately high number of IBS patients for both men and women. And this ranges from decreased sexual drive, and the most common symptom is actually reporting painful intercourse. So guys, back to the menstruation for women and for men and women, intercourse is not supposed to be painful. So be open with your partner, and if you're having difficulties with this, explain to them why, going back to the very beginning, you don't want to hide this from people because they can misinterpret that as you're not into them or whatever it is. And then also open communication is always going to make relationships more stronger. So it will definitely, help the relationship. And if you don't feel comfortable, then talk to your healthcare provider if it's an issue, to communicate with them. But I just want you guys to be aware that painful menstruation, painful intercourse, it's not normal, and it could be related to IBS. Okay, tip number 16, eat consistent small meals before a large event. But in general, I think even if it's not before a large event, we definitely want to keep our colon stimulated and things kind of moving. Unless you're having a crazy episode of diarrhea, then we want to kind of keep it bland and boring, and we might not want to eat too much. But the thing is that before a big event, you might come across certain foods that can trigger it and make it worse. You might be misguided to attempt the onset of the symptoms, and you might avoid food before a big event because you're afraid of having to use the bathroom there. The problem with this strategy is that your body may overreact when the food is finally introduced, especially if it's in a large quantity. So that's the big issue when it comes to large events. I know a lot of people don't want to have to use the bathroom in public, but guys, that's another tip that is a bonus tip, but I understand using public bathrooms might not be what you feel is the most sanitary or clean or ideal, or maybe it's an embarrassing thing. I'm not quite sure. But holding in your stool when you actually have to go is really not great for your digestive tract. So try to, if you have to bring Lysol wipes and put the, or squat or put the thing over, whatever it is, if you need, we gotta be okay with going to the bathroom in public because you can't hold it in. It's really, really bad. And then those who hold in their urine, this is not outside of IBS, that is bad as well. That's how people get UTIs. So please, if you gotta go, go. All right, so tip number 17 is actually all about peppermint oil. So peppermint oil might relieve symptoms. Peppermint oil taken before meals has been shown to relieve symptoms in the short term better than placebo in IBS patients experiencing abdominal discomfort. It works by decreasing the muscle spasms in the GI tract. And that's actually, you can purchase that over the counter. But just remember, it can cause severe heartburn. So take it in the capsule form. And also, like anything when it comes to taking like kind of like a supplement or a natural remedy, more is not always better. So just take it as it advises. Okay, tip number 18, when you're traveling. So be sure to be prepared when you travel. If you do take medications for your IBS, always bring them with you, and keep one in your hotel room or in your backpack or even in your purse when you're not like traveling on like a big trip, but just like day to day. Always have that with you just in case. And also bring your physician's contact information with you so that you can reach them at any moment's notice if you actually need it. And I think that's for anyone if you have a medical condition, and even not. I mean, I think always making sure that your insurance card is in your wallet, and then certain doctors that could need to be communicated with in time of emergency, like especially those with conditions like, say, diabetes or high blood pressure or high cholesterol. That's always an important tip, to make sure that it's clear that within your wallet there is a medical professional that you can contact in case of an emergency. So almost at the end here, guys. I know it's a lot of tips, so hopefully this isn't overwhelming you, but giving you a few ideas that maybe you haven't heard of before. Tip number 19 is actually all about yoga. So there's a lot of studies to support yoga for IBS, probably related to the decreasing of stress, like that meditation technique that we talked in the beginning, and also it incorporates movement, which is helpful. So meditation and movement is basically yoga together. And it might help lessen symptoms of those abdominal pain, the bloating, the flatulence, and diarrhea. They have little potential concerning side effects, and it's might be a very helpful way to also just promote general stress reduction. So I think we can agree that yoga has a lot of benefits, even outside of IBS, just in general, and our overall well-being and outlook in life. I'm a big believer in yoga. So tip number 20, if you're wondering, okay, well, what foods are making this worse for me? I had done an entire episode about the FODMAP diet, so I'm not sure if you heard about that, but so FODMAPs are fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, and these are all short-chain carbohydrates and sugar alcohols that are poorly absorbed by the body, particularly those with IBS, resulting in abdominal pain and bloating. They can occur naturally in foods, and they can also be included as additives. So go to episode 94 to learn more about that. I don't love the low FODMAP diet. I think it's more restrictive than the 4 to 12 week elimination diet. I think it can be helpful, but I do believe that we all are individuals and that some of us can benefit from a low FODMAP diet. And then the question is, which FODMAPs? And listen, it's pretty complicated. That is definitely something that I strongly advise utilizing if you want to try it under the care of a registered dietitian. But in addition, if you kind of were just looking for kind of like the other, like the 4 common food offenders for IBS, it's caffeine, chocolate, fiber, and nuts. So those are the big ones that we definitely want to limit, or being, treating yourself like the individual you are. And so making a list and try to eliminate one of those at a time so you can notice if you're feeling improvements. And if you don't notice an improvement after, say, eliminating caffeine for 12 weeks, then know that you can bring that back in. Same thing with chocolate, same thing with fiber, and same thing with nuts. All right, guys, the last tip of the day, really, really important one, tip number 21. You might want to consider adding prebiotics, and more specifically, I have a special offer just for you, which is the Alios Restore IBS Restore. So Alios IBS Restore has been clinically proven to help nutritionally manage the symptoms of all types of irritable bowel syndrome, including constipation, diarrhea, and a mixture of both. Many who use this medical food have experienced relief in symptoms such as less bloating, less diarrhea, less constipation, and more normal bowel movements. 48% of users reported an improved overall quality of life, including an increase in energy, decrease in irritability, and just an overall better mood. It comes in a powdered form, so you can put it in your water, in your smoothie in the morning, or even your hot or cold cereal. It doesn't have any flavor or coloring, so you won't even notice that it's there. Other than beginning to feel symptom relief after adding it to your daily routine for a certain period of time, it doesn't contain gluten, preservatives, GMOs, or soy, and it's free from artificial flavoring, sweeteners, and colorings. This is not like your typical probiotic. Haleos IBS Restore actually contains unique microbiome nutrients called HMOs that fuel the good bacteria that are already in your gut, rather than bringing in some sort of good bacteria that hasn't been there before. So unlike probiotics, which add foreign bacteria to your body, IBS Restore works with your body's own good bacteria. Simply put, it works by selecting, nourishing, and stimulating the growth of your own good bacteria, activating them to thrive and outperform the bad bacteria. So if you want to give Holy Ghost IBS Restore a try, go to holyghost.com or the link in the show notes, and don't forget to use discount TIPS30 to get 30% off your order. All right, guys, thank you so much for listening. I hope you found this episode helpful. If you did, definitely screenshot it, share it on your story, tag me at tips_with_Tony on Instagram or the Tips with Tony podcast. If you're not already subscribed to the podcast, please subscribe. It allows other people to find it. If you have any additional questions for me, email me tipswithtony@gmail.com. As always, thank you so much for listening. I'm Tony Marinucci, your registered dietitian, helping you get healthy one bite at a time.